According to a small study, psilocybin boosts brain activity in depressed patients. Participants in clinical studies often describe tremendous progress in taming the demons of post-traumatic stress disorder or finding unexpected calm and clarity as they face a terminal illness thanks to psychedelic compounds like LSD, ecstasy, and psilocybin mushrooms, which have shown significant promise in treating a variety of mental health disorders. However, how psychedelics could rewire the mind therapeutically is still a mystery. Before continuing, I ask you to subscribe to this channel and take a look below in the description of this video because I put a product that helped me lose weight, and I believe this can help you as well. Advanced neuroimaging equipment that probes deep into the brain, according to a group of neuroscientists in London, could give some answers. In research funded by Imperial College London, they gave 43 people with severe depression either psilocybin, the active element in magic mushrooms, or a standard antidepressant. The participants were not informed which one they would get. The researchers used functional magnetic resonance imaging, which captures metabolic function, to take 2 snapshots of their brain activity, one the day before the first dose and another 3 weeks later. According to research published Monday in the journal Nature Medicine, what they discovered was both metaphorically and literally enlightening. Participants who were administered the antidepressant escitalopram reported little improvement in their symptoms over the course of 3 weeks, and the scans remained to show the obstinate, unmistakable evidence of a mind hampered by severe depressive illness. Within particular areas of the brain, neural activity was restricted, reflecting the inflexible thinking patterns that may trap people with depression in a negative feedback cycle of pessimism and despair. The people who received psilocybin treatment, on the other hand, experienced a quick and consistent relief in their depression, and scans revealed flashes of neuronal activity throughout vast swaths of the brain that lasted for 3 weeks. They said that the increased connection reflected the cognitive fluidity of a healthy brain, which can switch between a morning episode of melancholy, a difficult day at work, and an evening of uninhibited celebration with friends. Learn about PTSD. PTSD's pervasive symptoms may affect both military veterans and civilians. The importance of early intervention in the management of the illness cannot be overstated. Getting rid of the stigma. People may be hesitant to seek therapy because of misconceptions about how PTSD develops and its symptoms. Psychedelic drugs, what are they and how do they work? Veterans are becoming surprising champions for the legalization of narcotics like MDMA as research into their therapeutic potential continues. Virtual reality, a therapy that uses cutting-edge technology to immerse patients in a memory simulation, might help them recover from trauma. COVID-19 has aggravated mental health concerns among medical staff, placing them at risk of acquiring PTSD. It would seem that psilocybin enables you to view things from a totally new perspective, especially when you have a psychotherapist who can assist in guiding you through that experience, said Richard Dawes, a cognitive neuroscientist and one of the study's primary authors. You can unravel unpleasant events that may determine how you perceive the world, which is intriguing since that's precisely what conventional cognitive behavioral therapy aims to achieve. According to experts who were not involved in the research, the findings were not wholly unexpected, but they did provide a plausible physiological explanation for anecdotal stories of therapeutic successes with psychedelic drugs. The results might help explain why study volunteers in psychedelic research commonly experience long-term alleviation from psychiatric disorders. According to Patrick M. Fisher, a neuroscientist at the Neurobiology Research Unit in Copenhagen who studies psilocybin's effects on the brain, 1 or 2 doses of psychedelic substances seem to provide long-term therapeutic advantages and changes in personality and mood, which is a unique property of medications. He added, although these brain imaging data are vital for resolving the brain processes that sustain these long-term alterations, this research raises significant challenges. Other academics concurred, stating that the findings emphasize the need for further research. Dr. Stephen Ross, Associate Director of the New York University Langone Center for Psychedelic Medicine, who has been studying the antidepressant effects of psilocybin on cancer patients, cautioned against drawing broad conclusions due to the participants' brain activity being monitored for such a short time. It's a little like going out into the cosmos with a telescope and seeing intriguing things and then building hypotheses based on those, He said, "This is a valuable contribution, but I'm more interested in what will happen in 3 or 6 months." A second, smaller trial published in Nature Medicine seems to back up the idea that psilocybin treatment might have long-term benefits. 16 participants were enrolled in the study with the expectation of receiving psilocybin to cure their treatment-resistant depression. The findings of brain scans obtained a day after the last dosages were given were comparable to those of the other trial. When the researchers checked in 6 months later, several of the subjects indicated that their depression had not improved. "These findings are really encouraging," Dr. Dawes said, "but clearly no one should go out and attempt to get psychedelics without first seeing a doctor or therapist." After decades of research gaps caused by anti-drug legislation that precluded most scientists in the United States from exploring mind-altering chemicals, the science of psychedelic medicine is still in its infancy. However, as the stigma has disappeared and research funding has become more plentiful, a rising number of experts have started to investigate whether such medications might benefit patients suffering from a variety of mental illnesses, including anorexia, substance misuse, and obsessive-compulsive disorder. In MDMA, psilocybin has shown great promise, according to research published in Nature Medicine in May. The medicine, when combined with talk therapy, may greatly reduce or even eradicate PTSD symptoms. Phase 3 clinical studies are already ongoing, and some experts predict that the FDA may authorize MDMA treatment for PTSD as early as next year. According to the National Institute of Mental Health, depression is one of the most frequent and intractable mental health problems in the United States, with an anticipated 21 million individuals experiencing a severe depressive episode in 2020. Although Prozac and other so-called selective serotonin reuptake inhibitors have proven to be effective for many people, they come with significant side effects and do not work for everyone. As a result, the limited research on psilocybin and depression has enthralled mental health professionals and patients alike. Robin Carhart Harris, head of the Neuroscape Psychedelics Division at the University of California, San Francisco, and another author of the Nature Medicine research, said the functional magnetic resonance imaging scans provided fascinating information about how depression occupies the brain. He said that the resultant photographs were best matched to an undulating pastoral scene with hills and deep valleys. People who suffer from depression, he claims, often find themselves in a valley. Although SSRIs may help people feel better, they do not seem to modify the general geography of their brain, indicating that the medications accomplish nothing more than alleviate their depressive symptoms. But, he added, psilocybin treatments seem to provide a path out of such metaphorical troughs by producing what scientists call global improvements in brain network integration, basically reactivating activity across previously cut off areas of the brain. Dr. Carhart Harris said, "Psilocybin treatment seems to level the terrain so you move out of the valley. It frees you up to go on." Nonetheless, he admitted that the 2 experiments created a slew of unsolved problems, which he hoped academics would investigate. He also warned against the blind acceptance of psychedelics without supervision, pointing out the extreme vulnerability of patients on a psychedelic excursion. "It may seem cliched, but I believe psilocybin treatment opens up the mind, and that is its power," said Dr. Carhart Harris. However, it is undoubtedly where the danger lies, which is why it must be controlled and done in conjunction with psychological assistance. Thanks for watching this video. Bye-bye.